So my name is Emelia Benjamin. I'm Assistant Provost for Faculty Development and Professor of Medicine and Epidemiology at Boston University. And it's my honor to be the moderator for Boston and COVID-19 vaccine by the American Heart Association. I'm going to be introducing the panelists, Chief Marty Martinez, Chief of Health and Human Services for the City of Boston, and Neil Maniar, who's president of the Mass Public Health Association and associate chair, Department of Health Sciences, Northeastern University. Thank you all very much for being here. So I think we would start out just by what have been some of the barriers in getting the vaccine to everyone specific to Boston? And I was hoping that Chief Martinez could answer that.
Sure, and thank you for having us today for this important conversation. I do appreciate it. I think for the city's end, getting access to the vaccine is a challenge across the board in many different facets, and I'll just take a couple to share with you. One, I think, is really about making sure that we have access locally in neighborhoods and in communities that are hardest hit, that people aren't trying to feel like they're going through every obstacle possible to get an appointment or to show up or to all the things that we know make it a challenge. So accessibility on the ground is super important, but also building widespread support is still a challenge. Making sure that people understand its effectiveness, making sure that people understand how it was tested, who it was tested on, and ultimately how it's going to protect yourself and your families. So I think access is key. I think understanding widespread support for it is really important. And then last but not least, I think is really making sure that we're doing everything we can, neighborhood by neighborhood, community by community, to combine those two, education and information and access, so we can really make sure that we get widespread acceptance of the vaccine. So those are just some of the challenges that I think we see.
Thank you. Professor Maniar, do you have any other comments?
I think Chief Martinez hit on all of the key points. I think as we think about sort of the way that the access to the vaccine has been structured, thinking about many of the pre-existing inequities that really have amplified many of the challenges that we're seeing in communities, and thinking about the role of technology in all of this. And one of the things I found myself talking about a lot lately is the role of technology as a social determinant of health. And I think as we look at the mechanisms that we need to use to access vaccination, to access knowledge around vaccination, to be able to have access to a device that can reliably connect to the internet, to be able to navigate these very complex registration systems that themselves are not, very user-friendly and very well designed, as many of us have found. That those having a system that is based on the use of technology, I think really amplifies many of the inequities and really amplifies the barriers to access that many communities were facing. So I think that has certainly been a key barrier. And then, also want to reiterate, the importance of education and really transparency, of really being able to convey information to communities about the development process around vaccinations, being able to give them the information in a way that they can really utilize that information to make decisions about their own care, about whether or not to get a vaccination. Because I think part of the distrust around the process is around, kind of that lack of, is partly, not entirely, but partly a function of that lack of transparency.
Yeah, I think you're bringing up a very important point. One of the things I neglected to mention in my introduction is that I practice at Boston Medical Center. And when I talk to my colleagues across town, they're doing video conferencing with their patients, et cetera. And in our patient population, it's been much harder to do video conferencing. A lot of people don't have smartphones, they have inadequate internet access, et cetera. A lot of times all that can be mustered is a telephone call. And of course, one can be potentially reimbursed less. So it's a beautiful example of reverse Robin Hood, where wealthier hospitals are able to have patients who can do video conferencing than sort of more safety net hospitals. So it's part of the structural inadequacies and structural racism of our system.
Yeah.
So I want to turn to, we know that COVID-19 has disproportionately affected communities of color, particularly the Black community. How do we prioritize BIPOC communities for the vaccine? Professor Maniar.
So we've seen really significant inequities in terms of the rollout for the vaccine. And I think we're in a situation right now where not just our state, but communities around the country are trying to play catch up. We knew going into this pandemic that that many communities, if we think about sort of, within the Black population, that there were significant disparities in health outcomes. If we look at some of the health outcomes that really increase the risk for having severe illness, for mortality from COVID, that the rates were significantly higher among Black individuals compared to other races and ethnicities. Once vaccines became available, it was imperative that we design systems that really addressed these disparities, that really made vaccines more accessible. And I think one of the challenges right now, so I think there are probably three key things that immediately come to mind, that we really need to pay attention to. So one, we really need to pay attention to the historical mistrust with the healthcare system, and to acknowledge that, and to really take steps to build trust, and to build trust around the vaccination process. Because if that both mistrust and kind of the lack of knowledge, right? If we don't understand, so I would be very reluctant to get something if I didn't know what it was, if I didn't know sort of what are the benefits of this. And I think really having education around that, having education that is tailored to many different languages and many different cultures is really important. I think the other piece is really kind of building trust by working closely with community leaders, working closely with other organizations within the community. I think one of the things that we really need to do is to work more closely with local health departments in communities. That is, one of our most powerful opportunities to really be engage communities and to be able to increase the number of individuals who are getting vaccinated. So I think, getting as local as we can, really paying attention to sort of tailoring approaches, educating communities and educating individuals, and really acknowledging and addressing the fears and concerns that individuals may have around this vaccine, and doing it in a way that is absolutely honest and transparent, I think is what we need to do. And I think that's going to be at least some of the important mechanisms to increase vaccination rates in different communities.
Chief Martinez, same question to you, and particularly I'd like you to drill down on the issue of trust.
Mm-hmm. Yeah, I mean, I think the pieces that Neil mentioned, I think are so key. And I think in order to build trust, it's not only trust in the vaccine, it's trust in the process. It's trust in that you're really making this accessible to me. It's trust in making sure that all those other inequities that communities of color face that are separate from COVID, that have felt like the system wasn't built for me, the system wasn't made for me to get care. Those things have to be recognized and really be focused on, right? So in the city of Boston, for example, although Black African Americans are disproportionately have a higher rate of dying from COVID than any other population in the city. Latinos actually have the highest rate of infection in the city and have had for the past 6 months and cumulatively. And I think if you just look at those two specific subsets of populations, there are many issues that go into that trust. So if you're talking about immigrants, whether they're Black or Latino, but if you talk about immigrants having distrust of the government, distrust of a system where there's been 4 years of anti-immigrant rhetoric that has perpetuated the notion that you're not welcomed here, we don't want you here, and we're going to do everything we can to make these systems not work for you. I think that if you just take that example, you have to really figure out how you manage rebuilding that. So I'll give you a real concrete, like, operational example. I always say that if someone says they're going to go do a mobile clinic, and I'm steep in these conversations now, you're going to do a mobile clinic in a neighborhood, and you say you're going to vaccinate 100 people, but last minute you can only do 50, and you can't do as much as you want because you didn't have the doses, or whatever ends up happening. That operational challenge actually inadvertently contributes to a lack of trust. You said you could vaccinate in my neighborhood. You said you could do this in my community. I show up, I only speak Spanish. No one here can help me. It's not as much as just trust in the vaccine, but it's actually trust in the system. And so I really think for the city, we've been working in partnership with community organizations, nonprofit partners, medical professionals of color, which I think have been a really important part of this sort of system. But you have to build upon all of those pieces to really make sure that we're not just looking at the historical context, but most people who have distrust in the system, it's something the system did to them last week or a month ago. It's not necessarily just the historical context that we're sort of working on, but we have to be intentional about it and recognize it and then address it.
I'm interested for both of you to speak about what kind of concrete steps can higher ed, what kind of concrete steps can this city, and we're talking to the Business Roundtable, what kind of concrete steps can all of us take to help with the trust issue?
I can give you one. I mean, I think the concrete steps that on the city end is, we back in April of last year created a health inequities task force specifically focused on COVID. We've been meeting with that task force once a week in the height of our surge, twice a week. And these are community leaders. These are nonprofit organization leaders. These are folks of color who are driving issues around equity and access. And we in real time are listening to what they have to say, understanding some of the gaps that are there. If I come to them and say, listen, testing is down in this neighborhood, or vaccination uptick is down within this population, they're troubleshooting solutions, ideas, and thoughts, and then we're working together to try to implement them. I think we have to make sure that we're not trying to solve problems in silos. Institutions of higher ed, institutions of business community, healthcare organizations. If you're only talking to yourself, that's part of the problem. So real specifically, we have hospitals that reach out, we have community groups that reach out with ideas, and we also are doing the same thing. So I think we have to talk to those folks that are embedded in the community, but at the same time, connect resources to ideas to really tackle some of those strategies. So for us, that's one of the things we're doing on the city level.
Thank you, Professor Maniar.
So I think there are a number of really important opportunities. So I think the piece around engagement is really important, and really making sure, Chief Martinez hit on such an important point in terms of making sure that we don't do this work in a siloed manner, that we really do it collaboratively, that we work across our different kind of boundaries in terms of disciplines, and really have a truly interdisciplinary and truly collaborative approach, but also making sure that we see the community as equal partners in this work. So engagement, I think, is a really important component of this, and leveraging our existing collaborative work to now sort of help to address the inequities that we see in vaccine access, to help to ensure that as many people are getting vaccinated as possible. And I think that leads to the second thing, which is around advocacy, and really leveraging our roles as institutions and the capital that we have to advocate for communities, to advocate for what they need, and to do it with the voice of the community. And to do it in a manner, again, that is honest and transparent, and that where we are accountable for our roles in this work. And I think that accountability, I firmly believe that accountability is such an important cornerstone of trust, and really making sure that we all play the role that we need to, and we're accountable for that work to advance vaccine equity and to ensure that individuals are getting their vaccinations. So I think those are some of the key pieces, but I think the other piece is also really kind of leveraging our expertise to help to educate the community, to help to create mechanisms to share information with the community. One of the things that colleagues here at Northeastern did through our Center for Resilient Cities is they developed a series of modules, education modules to educate communities around what the vaccines are. And they were informed by faculty in our pharmacy school and nursing school, and available in different languages. And I think for all of us as institutional partners in this work to really bring our own resources to the table to help communities and to really make that freely available to communities. Because I think that's another part of building trust is we understand what is needed and we're going to do something about it because we have the ability to do so.
I would just add that the American Heart Association has been investing in communities rather than just saying, oh, we're the American Heart Association, we have all the answers. Through a social impact or social equity fund, we're actually investing in initiatives that are from the community to help build capacity in the community to solve the community's problems. So I think we're all saying the same thing, which is that this can't be done alone, it can't be done in silos. I want to just pivot now to, in Massachusetts, we have access to Pfizer, Moderna, and Johnson & Johnson vaccines. We know that Pfizer and Moderna are 2 shots, while Johnson & Johnson is a 1 shot. Should people be concerned about which version they're getting, Professor Maniar?
No. All 3 vaccinations have been shown to be safe, have been shown to be effective. When you have the opportunity to get a vaccination, get your vaccination, whether it's Pfizer, Moderna, or Johnson & Johnson. The best vaccination is the one that you get. And that is, I firmly believe that, all three are really good options, and we're fortunate to have all 3 available.
Yeah, I couldn't agree more. I actually was a volunteer for the Pfizer trial. So I got Pfizer after I got unblinded. And I have to be honest with you, being able to participate in the trial was one of the, I feel like it was an accomplishment for my life because I'm a scientist. And so I felt like I have an obligation to contribute to science. And it was really an honor to be part of the Pfizer trial. But they all work well. They don't work if you don't take them. So Chief Martinez, on April 19th, Massachusetts is going to open vaccines to everyone 16 years and older. What challenges are we going to face when we head into this? It's what they said is the last mile of the vaccine rollout. It feels like a marathon, not a mile to me, but.
Right. I think the challenge we're going to face has been part of the challenge that we've been facing for a while. Supply has to meet eligibility. And, I think that's part of just a general operational need and effort. I think that's a key piece, right? I actually think, though, however, the opening of eligibility is a really important tool to figure out how good our equity efforts actually working. Because right now, the challenge of eligibility limitation is that I can do, and community groups can do all the work they want to do, but half the group you might be reaching isn't even eligible yet. We know that for example, in the Latino community in Boston, it's the youngest of all the populations in the city. Yeah. So the overwhelming majority of Latinos are not eligible yet to be vaccinated. Even though now we have some categories where there's more folks eligible. So I think we're going to learn a lot more very quickly in terms of where we've made some inroads, where we've seen some progress. I think it'll also be important to no longer have to slice and dice who you're reaching out to, where the outreach is happening, what we're trying to do. The city's releasing a vaccine equity fund, a grant initiative that we're releasing actually tomorrow for applicants, for community-based organizations and clinical partners to work together to create some access. Our new mayor, Mayor Janey, has released these funds, and the goal of that is to be able to bring some more access, real specific equity efforts on the ground to fund them to be able to do that in advance of or to be available when full eligibility is there. So I think it's going to be a really important part when we have more widespread eligibility. And I know no one believes this, I think, yet, but we will get to a time where we have more doses than arms. that are waiting to go for those doses to go into. And that's when really this real work starts. I would agree with you that this is not the last mile. To me, the 19th is like just turning the corner after the half block of this race. And there's a lot more work to be done once there's widespread eligibility.
Yeah. Any other thoughts, Professor Maniar?
Yeah, when you had mentioned the last mile, I was thinking, if we put this in the context of the marathon, we have Heartbreak Hill ahead of us right now. So I think as eligibility expands, this is really our opportunity to ensure that we're addressing those key pieces around equity and making sure that, to the earlier question around prioritizing access and really prioritizing access in a way that we are able to address some of these equity issues, partnering with local health departments, partnering with other local organizations to not only build the systems needed to make sure that individuals have access to the vaccine, but also this is our opportunity right now to address that hesitancy around vaccinations and to make sure that we are allaying concerns, that we're addressing concerns that individuals may have, that we're going that extra mile to educate communities about the importance of getting a vaccine and the benefits of getting the vaccine, but also addressing some of those other issues that are so important. So when we think about equity issues, it's not just equity around access to the vaccine, but it's equity around making sure people have the ability to take time off to get their vaccination. Making sure that if they have side effects and they're not able to go to work for a day, that they don't have to worry about their job. So what is the role of employers in all of this? How do we think about some of those broader equity issues? Because those will become even more prominent as more individuals are eligible to get the vaccine. And especially as we think about more individuals who are worrying about what's going to happen to my job. Can I take time off? How am I going to get to a vaccination? How am I going to navigate the system? So we know these problems exist. We've taken some steps to address some of these issues, but we need to really accelerate that as we prepare for this broader eligibility.
Makes complete sense. How can biopharma and the biotech industries play a role in this vaccine rollout? For instance, can they encourage residents to get vaccinated and help them make the rollout as equitable as possible? How can they be part of the solution?
So the one thing that immediately comes to mind as I think about biopharma and biotech, the work that has been done to develop these vaccines is extraordinary. The science behind it is extraordinary. I think they have an important role in education, but I also think they have a really important role in funding and really being able to provide the resources and support needed to educate communities. So rather than the educational efforts coming from the biopharma sector, for them to provide resources to community organizations and to communities to really be able to lead these efforts and to have those efforts shaped from the perspective of the community. I think they are key partners in this work, and they should be key partners at every level of this work. So I think they have a real important role around education and around funding, and also around again, helping to build trust. There's still a lot of work that needs to be done, and I think I don't see their role stopping with sort of making the vaccines available. I see it really extending all the way through to when individuals get the shot in their arm.
Yeah, Chief Martinez, any other thoughts?
Yeah, no, I think those are all the main pieces. I think generally the pharma and in my mind biotech and the business community in general. I think it's being part of the fight and the struggle, right? In fairness, nonprofits, community groups, they're tired. Local government, I'm tired, and so I think we need our business community and those partners to be at that table, whether it's all the ways that Neil mentioned, through financial resources, through sharing with messaging, to thinking about space that they're making accessible, all the things that the community has the ability to do, because community groups are stretched thin. I think that's an important, I'm a nonprofit guy who just happens to be working in government right now. And so I know that all the things that nonprofits are asked to do, and I think they're so vitally important, but they are stretched very thin right now. So I think it's really, really important that the business community also not only do those pieces, but also the creativity that sometimes exists in that private sector definitely exists to create these vaccines as quickly as possible. I think it's important that we use that creativity as we think about the pathway of getting, so many more people vaccinated here in the city.
Thank you. So I know we're still in the thick of the COVID pandemic and the vaccines rolling out. And we'd like to think that this is an every 100-year phenomena and we'll never have one of these in our lifetime, but I'm not convinced of that. And I don't think anybody else is. So when we think about what have we learned so far? What have you learned so far that you will take into or prepare for the next pandemic? Chief Martinez.
The next pandemic, Dr. Benjamin, that's a tough one. I'm not finished with this one, but I hear you. I hear your question. I think the one from my vantage point, the public health infrastructure and the system itself has been, the flaws or the gaps have been exposed, right? And so there's no question that I think that's the biggest lesson that we have. When we're thinking about budgets and funding and recovery, there's so many things we need to focus on and all the inequities that there's been a bright light on. But I think the less sexy version of that is the public health gaps in terms of infrastructure and all the things that people know about now, tracing and testing and vaccinating and all those things that have been happening for a very long time on the public health side. They were not prepared for this pandemic. They have not been built up in the way they need to be. And so for us on a city level, we've really learned how important that is. And we have one of the best health departments in the country here in the city of Boston. So there's no question to me, that's a big lesson that we must tackle in order to be ready for likely another situation like this in the future.
Thank you. Professor Maniar?
Yeah, it's, I share Chief Martinez's perspective that we're really not quite ready to think about the next pandemic, but we have to. I think as we know in public health that there will always be another crisis, and it's important that we learn from our current experiences to ensure that we're able to tackle whatever lies ahead as best as we can. I think there are two components to this. I think there's the next pandemic, but there's also what we know is going to be an ongoing need to vaccinate individuals against COVID. And so the three things really jump out for me. I think one thing that we've learned is that there are populations that are experiencing significant disparities with respect to a range of health outcomes. In the context of a pandemic, those individuals are much more likely to experience poor outcomes. So it is imperative that we do all that we can to tackle those existing disparities right now so that we can enable individuals to have the best possible outcome in the midst of a pandemic. The other thing that we've seen is that pandemics amplify existing inequities and disparities, and not just health inequities and disparities, but when we think about housing and employment and all of these other areas, how they have been amplified in the midst of a pandemic, and the need to address those, because these are not isolated scenarios. We know that a pandemic sort of touches everything. So as we think about what's next, the best way to prepare for that is by addressing all of these other factors. And I think the third thing is really thinking about our infrastructure, our public health infrastructure, but also thinking about the lessons that we've learned as we rapidly roll out new systems for vaccination, as we try to educate communities and we try to build trust with communities, because this is our opportunity to do that. In the midst of a pandemic, we have an incredible opportunity to learn and to prepare and to grow stronger. And I think that's really what we need to do right now as we prepare for the next pandemic, because there will invariably be other pandemics.
Dr. Benjamin, if I could add just one more thing, which is many institutions, and I speak for my own city government, have had to be nimble and respond to crisis, and a crisis that's lasted, 14 months. And so, and that's been important. And we've had to do that, and we've done it, and we've responded, and that's been key. We have to take that same sense of urgency into those inequities that Neil just talked about, right? So we see the inequities, we know what they are, but the way we've responded to COVID has forced us to be nimble. It's forced us to not say, sure, we'll study this for 9 months, and then we'll go and create some strategies. And so I think that's true not just for government, I think it's true for hospitals, for higher education institutions, for companies. So I just think we also need to think about how we move with urgency, not just when there's a crisis that everyone reads about every day online and in the news, but that's going to be really important as we move forward.
Yeah. To make it clear, I'm a volunteer for the American Heart Association. I'm not paid by the American Heart Association. And I would say that one of the things that I'm aware of, having been involved with the American Heart Association literally since the 1990s, is I have seen the organization change and shift. And one of the things that's happened in 2020, 2021 is that the American Heart Association is starting to talk about structural racism and had a very important presidential advisory. And so I'd really like to amplify what both of you have said, is that, it's that old adage, never let a good crisis go to waste. And if anything, this is really, there is no hiding the structural racism, the structural inequities in our system. And hopefully, if there's any silver lining, once we move farther through the pandemic, we will not lose that sense of urgency about addressing some of the fundamental inequities in our system. I'd like to ask the last question and start asking people if they have questions, putting them in the chat. And so what's really on everybody's mind is, when are we going to get back to normal? Dinners, restaurants, summer concerts, regular school schedule. I know that that's been a huge pain point for many people. And when we return to normal, will there be any restrictions in place, like wearing masks? I know in some parts of the country, they've already said, off with the masks. I'm interested in both of you answering that question, please.
Yeah, I mean, I think, it's when we get to normal, it depends on, what we think of that to be, right? I mean, we're many, many months away from having the numbers of people vaccinated, at least in the city, that we would need to loosen some of those restrictions. But I do think both on the larger end of the crises we've discussed, we don't want to go back to that normal. We absolutely need to figure out how we don't go back to those inequities in terms of the restrictions and the reopening and the pieces that are there. I think we're going to see many of those restrictions be loosened into the fall as we think about it. But I also think there's a lot of unknown. We don't yet know how COVID will play out season to season. We don't yet quite know what that's going to look like. I think face coverings and social distancing and some of these pieces will be with us for some time. It just depends on in what way. It also depends on what populations we're talking about. So I think, the normal where we no longer care about any of these things, that is not a normal that I think we're going to go back to anytime soon. But I do think you're going to, one of the things that I'll just say to you, I think so important, when we talk to people about getting vaccinated, we've had people say, like, I just want to, see my kids, and I just want to see my grandmother, or I just want to be with my family. And those things, we will get to those things. And those things are on the menu for the fall, I will argue. But again, they may not look exactly the way they looked before, but we will get to a better place sometime in the fall.
Yeah, I know that the first thing I did when I had my vaccine, and 10 days after my mother had her vaccine, she's 90 and is in failing health in Oregon, was I was on a plane, 10 days later. And that to me was my first pandemic wish. Right. So I but I wouldn't say that's normal. Dr. Maniar, Professor Maniar.
Yeah, so I agree with everything that Chief Martinez said. I think we're a ways away from kind of emerging from this pandemic in a way that we feel like we're at least sort of in a new normal, and a better normal. I think this pandemic will be with us for a while. I do strongly believe that the vaccination is a really important ticket to being able to resume some of those things that we used to really enjoy doing. And that's why it's so important that as many people get vaccinated as possible. and that we address these issues around vaccine hesitancy. I also think that every step that each individual takes, that each community takes to keep themselves safe and to keep those around them safe will get us closer to achieving that sense of normalcy. There's a lot of fatigue that people are experiencing, and there's this desire to really kind of get back to normal. We're close, but if the analogy that I often hear is it's like jumping out of a plane with a parachute, and that parachute has slowed you down, and you're 500 feet above ground. This isn't the time to release to let go of the parachute, right? You want to kind of get safely to the ground, and we need to get there. And the way that we're going to get there is, by continuing to wear masks, getting vaccinated, really being cognizant of the fact, that we need to keep ourselves safe and those around us safe, and advocating for the communities that need help, because again, it's going to be a collective effort to get back to normal. But I think, I'm confident that, by late summer, early fall, hopefully we'll be in a much, much better normal, and we'll just have to stay vigilant.
Yeah. So while we're waiting for the attendees to ask their questions, do we have any questions for each other? And actually, I just see there's one question in the chat, and while you're thinking of your questions for each other, there was a question about, what about the variants? And is that something that we should be worrying about? Will the current vaccine give us protection?
Yes, I can tell you from our end. Yeah, I mean, the current vaccines all have some level of effectiveness. And so the current vaccines, obviously we want people to take them. All three of the vaccines have, the J&J actually, even though it was tested in South Africa, and post the variants be more dominant, right? So I am always very careful to never lift up one vaccine more than the other. All three vaccines have some effectiveness. Having said that, we have to monitor the variants. We're seeing an uptick in cases across the country right now. We're seeing that at a slow rise. And so the variants we know are more infectious. We already know, based on some work with our hospital partners, that a good chunk, if not the majority of cases that they're seeing, that they're testing, are showing primarily the variant that was first discovered in the UK. So again, what we need to do is continue to do what we've been doing, right? And we need to make sure that we do all those things to protect ourselves. Having said that, we shouldn't be surprised if we see one, two of our vaccine partners say, here's a booster based on what we've seen from the variants, to offer even more protection. But people need to be really focused on continuing to doing what they were doing with those variants in our midst.
Yeah. And the one thing I would add to that is, so we know the vaccines offer really important protection, but it's not absolute protection. And I think this is why it's important that when folks are out in public, when they're in crowded spaces, that even after getting vaccinated, that they do wear a mask, because that will, again, help reduce the likelihood that these variants will lead to significant surges in COVID. And I think the more that we practice safe measures during this pandemic, the less likely it is that variants will emerge, because the variants emerge when we see outbreaks, when we see surges. And that's, again, why it's so important that individuals continue to practice these safe behaviors.
Yeah, just anecdotally, one of my, the two doctors that I know who had gotten the vaccines, both doses, and were extremely conservative on all of their use of protective equipment, basically got COVID after they were vaccinated. Very mild cases, and both of them got it from exposure to their children, basically, one from a daycare provider and another from their child who is in daycare. And so I think that, I don't know about you, I've been vaccinated because of Pfizer, because I was in the trial since December, and I'm still wearing my mask, and I'm not giving up my mask anytime soon. And I hope other people are aware that you're not, you will, if you do get vaccinated, you will get, if you do get COVID, it will by and large be a very mild case. You won't end up in the hospital, and you're very unlikely to end up, there's no cases, at least that I'm aware of, where people have died. But it's not time to let our guards down. One other question that came in through the chat was, with the variants on the rise, do we expect that shutdowns and on and off restrictions will become a daily part of our lives moving beyond the fall?
Yeah, I mean, I think the reality of this is, it depends on both the pace in which we vaccinate the large segment of the population. It depends on the cases and who gets infected. Lots of times when we talk about the inequitable impact of COVID, we forget that it's been on older residents. I mean, that older residents are who face the severest impact, not only from the physical pieces of it, but the social isolation for many of our seniors as well. So at this point where we see our cases, even the uptick in cases we see right now, it's in younger people. And so it doesn't mean that we're not concerned about it, but we don't expect to see that followed by increases in hospitalization. It doesn't mean it won't happen, but we don't expect to see a surge there. If we started to see that, that would raise the question about what we're seeing in terms of how infectious this is, and is it more severe than what we're seeing? So I don't think we're going to be in a scenario where you're going to see ongoing restrictions. You may see a slowing of those restrictions. Again, I can only speak for the city. The state sort of controls a lot of those things on that end, but I do think it's important that we monitor that. The only other thing I'll share that I think is important when we think about restrictions related to COVID, those restrictions have an economic impact that for many of our communities is almost worse than some of the impact that COVID has had. So I don't want to ever lose sight of that. I think sometimes we, as public health professionals, we're quick to say, we should shut this down, we've opened too soon. For many families, keeping a roof over their head and food on their families' tables, that becomes the barrier when we close those things down. So I think it's a balance, and I think it's a balance we're going to live with for quite some time.
And I might add, also having your children in school.
For sure.
A whole bunch of inequity issues with that as well.
For sure.
So we have about 2 minutes left. Do either of you have either a question for the other person, or do you have a statement that you wanted to make sort of as we're coming to a close?
I can make a final quick thought that I'll just share with folks. I just really appreciate the opportunity to be able to lift this up and have this conversation with you all and all the work that the Heart Association is doing. The one thing I'll share with you, I think one of the moments that have been so fitting is, when the city reopened our vaccination site at the Reggie Lewis Center. We ran that site for several weeks so that we could create access in Roxbury. And one of the first couple of days of that site, being able to go there, I worked the vaccination site a couple different times. And I think, it was in my face how full circle this was. Seniors over 75 coming in to get vaccinated, talking about the impact it's had socially, emotionally on their mental health, and connecting with folks. And sometimes I do press conferences with the mayor, and so they recognize my face and wanted to talk about some of those things in the city. But I share with you that I think for many people, the physical side of COVID has been, the least impactful for many people. It's been the social emotional pieces. It's been the lack of human connection. And all of those pieces will take a long time to recover, well beyond vaccinations, well beyond the efforts that we're in. And so we need to focus on that just as much and add that to the conversation.
Yeah, particularly for older adults. I know that vis-a-vis my mother. Professor Maniar, closing thoughts.
I'd love to pick up on what Chief Martinez just shared around the social and emotional piece. So I think as sort of like a final statement, one, thank you to the American Heart Association for really for inviting us and for really this important conversation. I think I firmly believe that there's a role for everyone in helping us to emerge from this pandemic, helping us to return to a better state of normal. For those of you who are out there who are trying to, who are thinking about, well, what can I do? There are opportunities to educate others about the importance of vaccination, to volunteer, to help others get their vaccination. This is a true collective effort. And I think that is, when you look at some of our real success stories, those success stories are grounded in collaboration. They're grounded in people coming together. And I think that is what will not only get us through, but get us to the other side and help us grow stronger through this, and to continue to stay vigilant. It is tiring. And I know that there's this real desire to want to sort of get back to that 2019 state that we were all in. We'll get to a much, much better state. And the best way for us to get there is to stay vigilant, get vaccinated, and continue to look out for ourselves and for one another.
Thank you. Well, on behalf of the American Heart Association, I wanted to thank our attendees for attending, and also particularly to our incredibly informative speakers who have really enlightened us about the importance of vigilance, the importance of addressing some of the underlying health inequities, and the importance of us working across industries, across sectors, so that industry is collaborating with higher ed, with hospitals, and also with the city and NGOs. Thank you all so much for your time and attention. Really appreciate it.
Thank you, Dr. Benjamin.
Thank you.